Okay, so good afternoon, and thank you all for joining our webinar today, discussing some of the highlights from our new report, Exploring Food and Eating Trends Among Ontario Families with Children. My name is Marissa Lestry, and I'm a Program Assistant at Nutrition Connections, a center within the Ontario Public Health Association. Just to let you know, we've put everyone on mute and closed all the videos as we are recording this webinar, and we'll be posting it later on our website. If you have any questions that come up during the presentation, please put them in the Q&A section. I am now pleased to welcome our speaker. Lynn Roblin has been working as a member of our team at Nutrition Connections and OPHA for over 6 years. She has had many years of experience working on issues related to food and nutrition policy and promoting healthy eating and food literacy. For the past few years, Lynn has focused on applied research activities to understand the state of healthy eating and food literacy in Ontario and Canada, including the report we are going to hear about today. Welcome, Lynn, and over to you.
Thank you very much, Marissa, and welcome to all our webinar participants. It's our pleasure to be here today to talk about our new report. But before we start, I wanted to provide a little bit of background about us and Nutrition Connections. We are a center for nutrition services, including resource development. We provide education and training, and we support knowledge exchange and collaboration. And we help those involved in health professions, businesses, government, community organizations, as well as educators and researchers and others working in food and nutrition. We help them meet their organizational needs to learn, connect, and share information. We were formerly called the Nutrition Resource Centre and have been part of the Ontario Public Health Association for over 20 years. We have been funded for much of that time by the Ministry of Health and Long-Term Care, but for the past several years, we have been generously supported by the Health Relief Foundation and others. Over the years, our team has been examining the state of food literacy in Ontario, as this can have an impact on improving food choices in children and families. We've looked at the key players, policies, and programs that make up the food literacy landscape in Ontario. We've produced evidence briefs on effective approaches to increase food literacy in children, youth, and parents. We've looked at policies that can influence food literacy among children and youth in Ontario. And recently, we hosted a workshop with researchers, practitioners, and policymakers to identify the key priorities for food literacy research and policy action going forward. This work is not done alone, and we acknowledge the many various partners and advisors who have collaborated with us to shape this work, and their logos are shown on this slide. So before I get into talking about our new report, I wanted to jump back in time. And it's funny, in our organization, I'm known as the trusted gatekeeper of all information. And funny enough, I do have Nutrition Canada surveys done way back in 1970s. And so I just really wanted to use this visual as a springboard to talking about why tracking nutrition trends is important, and talking about why we need to know more about food consumption and eating habits. As you can see, more than 40 years ago, Health Canada conducted a series of reports on the food and nutrient intakes of Canadians, including reports on each province, and I highlighted a report here from Ontario. This was done in the 70s. We did not see another full nutrition survey until the 2004 Canadian Community Health Survey, and then not again until the 2015 Canadian Community Health Survey nutrition component. Monitoring the food and nutrient intakes of Canadians is terribly important. This data is needed to make evidence-based decisions around policies and interventions, such as our food guide and dietary guidelines. And these are intended to improve the eating behaviors and health of the population. Some researchers, like Swinburne and colleagues who chaired an international group called Informis, and our own researchers here in Canada, Mary Labbe and Lana Vanderlee, who many of us worked with to inform their Food Epi Canada project, they have recommended regular nutrition monitoring of nutritional status be done at least every 5 years. So as we can see here, that hasn't been a possibility. And so there are certainly gaps in some of the nutrition data that we have that is in evidence here. So tracking dietary intakes and the eating behaviors is terribly important because diet and unhealthy eating in particular has been identified as the leading cause of chronic disease in Canada, contributing $13.8 billion per year in healthcare costs associated with diseases such as cancer, heart disease, and type 2 diabetes. This was based on not eating enough protective foods, vegetables and fruit, whole grains, milk, nuts, and seeds, and consuming too many foods that are considered harmful, processed meats, red meats, sugar-sweetened beverages, and others. About 3/4 of all deaths in Ontario were attributed to chronic diseases in 2015, and unhealthy eating was estimated to cost the Ontario economy $5.6 billion each year, with $1.8 billion lost specifically due to inadequate vegetable and fruit consumption. Healthy eating in childhood is important to promote healthy growth and development, and I'm sure we'll all agree with that. The formation of healthy eating habits can be carried into adulthood. However, children today have been reported to have poorer eating habits than previous generations and are at higher risk of having health issues at a younger age than their parents. Continuing unhealthy eating into adulthood can increase their risk of health problems, including obesity, heart disease, stroke, and diabetes. Children today are bombarded with messages about what foods to eat by marketing of foods both on TV and on computers and smartphones and other digital formats. Most of this marketing is foods that we may consider not the healthiest choices. In fact, a recent study has shown that over half of the calories kids consume today come from highly processed foods, foods that are high in sugar, salt, or fat, such as many snack foods, sugary beverages, baked goods, etc. So this has led our team at Nutrition Connections to examine the state of healthy eating in Ontario. And we've actually undertaken a series of 3 reports, all under the banner. Our first report we did back in 2017, and our focus was on the determinants of dietary intake, including healthy eating, food literacy, and food insecurity. We also examined general health indicators, including self-rated health and physical activity. These studies are based on the most recent Canadian Community Health Surveys. So our 2017 report shown here is already available on our website. The 2 new reports that you can see here, vegetable and fruit consumption, food insecurity, self-rated health and physical activity, the newer one is based on CCHS 2017. And another report we did along with the University of Toronto, Mary Labbé's lab, is looking at consuming intake of key nutrients and vegetables and fruit and comparing this to dietary recommendations based on CCHS Nutrition Survey 2015. These 2 newer reports will be on our website in January. Again, we acknowledge the various partners and advisors who have helped collaborate on these reports, including the Elderly Foundation, the University of Toronto, and the Public Health Agency of Canada, who was able to help us access the data. Through our research, we have identified a number of gaps in the information available. For example, few of the studies look at food attitudes and eating behaviors. Few studies look at children under the age of 12. Few look into what motivates people to choose the foods that they do, and none have examined families and their eating and meal patterns in detail. Few offer data at the provincial level. This brings us to our current report, which we're really excited about releasing today. Nutrition Connections, with support from the Elderly Foundation, teamed up with Ipsos to examine food and eating behavior trends in families with children in Ontario. Our goal was to develop a system to track and monitor food and eating behavior trends in Ontario and Canada. We wanted to understand the food and eating attitudes and behaviors of families with children and what drives their food choices. This information is needed to inform evidence-based collaborative actions to improve food literacy and healthy eating in children, youth, and parents. And this can be done through various policy, programming, and communication activities. The data we are discussing today is very hard to come by and very expensive to access. We are very fortunate to have the Elderly Foundation support this work. So a little bit about the study and the data. The data we used to track the food and eating behavior trends in this study was based on the 5 syndicated data collected by Ipsos Canada. This is a Canadian online diary that gathers information year over year on a daily basis with an annual sample of over 20,000 Canadians over the age of 2. The data set includes information on food choices, eating behavior, preparation, and purchasing details. The results report on the total intakes in a daily period expressed as a percentage. We also looked at total intakes for meals and snacks, with food and beverages expressed as a percentage of each of those meal occasions. I want to point out that the 5 study does not capture volumetric data, for example, the amount that consumers are eating or drinking in cups or servings. Who did we study? In this sample, we looked at a representative sample of Ontario residents. They have varied incomes, geographies, and newcomer status, much like the overall diversity we see in Ontario. The study is unique as it looks at families with children in different age groups, as well as parents of children in these 3 age groups, 2 to 5-year-olds, 6 to 12-year-olds, and 13 to 17-year-olds. This study is the first to examine the food choices and eating habits of families broken down by age groups in such detail. As you can see, the sample that we looked at had a higher percentage of children in the 6 to 12-year-old category and a higher percentage of parents in the 35 to 49-year-old age category. Before we go too much further, I do want to talk about COVID. The data that we present provides a snapshot of food and eating attitudes and behaviors of Ontario and Canadian families for the year ending in 2019. So it's a full year of data, January to December 2019. So as we all know, the COVID pandemic started in around March of 2020. And we do know that this COVID pandemic has impacted family eating and consumption patterns, as well as shopping and cooking habits and other situational dynamics. For example, we know that families are eating at home and that cooking from scratch experienced some growth during the early stages of COVID, as did the use of meal kits. In our report, we have included some of this data, but it's not going to be the focus of my of the data highlights I'm sharing today. While it is too early to tell the long-term impacts of the pandemic, it is important to consider that there may be long-lasting effects on the food and eating attitudes and behaviors of children and youth and parents, and that will be needing to be monitored going forward. We propose that our data set will be useful for comparison purposes in the years to come. So let's get started, as I wanted to take some time to share some of the key highlights from the report with you. We're not going to have time to share all of the findings with you because it's we glean quite a lot of data from this report. We have divided our results into 4 main sections for the report, and we're going to focus in on what families are eating and drinking for meals and snacks, where and how families are eating and sharing meals, how families are shopping and preparing meals, and what is driving family food choices. So just to give you an example, for the first section, we report on food and beverage intakes. And we see when we compare Ontario families to Canadian families, they're pretty much aligned, especially in terms of their intakes of vegetables and fruit, meat, proteins, protein alternatives, and grains. In our report, we break down consumption by food and beverages, and by the age of children, and by parents by age of their children. For example, this slide shows beverage consumption comparing Ontario to national families. As you can see, water is the most commonly consumed beverage for both Ontario and national families. Compared to the total national families surveyed, Ontario families reported consuming less caffeinated beverages and slightly more fruit beverages and dairy beverages. So we would have a slide on the consumption of the major food categories as well, which I'm not showing at this time. The major food categories are shown on this slide when we look at the breakdown of food and beverage consumption by the age of children. So again, we had the three different age groups: children ages 2 to 5, 6 to 12, and 13 to 17. In Ontario, we found that children ages 2 to 5 reported consuming more vegetables and fruit, more protein alternatives, and less total meat protein compared to children ages 6 to 12 and 13 to 17. Younger children also reported consuming more dairy beverages compared to children over the age of 6. Consumption of milk alternatives was relatively low. It's not shown on this chart, with less than 0.5% of Ontario families reporting they consume these beverages. So in our report, we would also report on the consumption of food and beverages of the parents of children by their children's age grouping. So again, I'm not showing that slide at this time. Our report also looks at what food and beverages children and families choose for breakfast, lunch, and dinner. In this slide, you can see the top food choices families reported consuming at lunchtime, and that both meat and proteins and protein alternatives are included. Looking at the age differences, fruit beverage consumption was reported to be highest at breakfast for children ages 6 to 12. And sugary snack consumption was highest for children ages 2 to 5 at dinner time. So again, those data points aren't shared on this slide, but in our report, we go into more detail, quite a bit of detail about snacking. For example, the top ranked snacks were sugary and salty snacks, followed by vegetables and fruit. And we also look at when the snacking is happening, and we found that most of the snacking, or 1/3, is happening in the afternoon. So we can show you by the day part when different foods are being consumed. In our second section, we focus on where and how families with children are eating and sharing meals. Knowing how they're eating and sharing meals is important to know, as parents are essential role models for children, learning about food and developing healthy eating habits. In this part of the report, we look at whether they're eating together, whether they're eating alone, where eating occurs, and what families are doing while they're eating. In this slide, you can see that we found more Ontario families reporting eating together compared to Canadian families. So looking at the bottom two circles. However, while Ontario families reported eating together more often than other Canadian families, they were more likely to have reported consuming different foods at the same meal occasion. So for the bottom circle, Canadian families reported 13.8 compared to Ontario 16.9%. This may suggest that meals in Ontario are more influenced by individual family member food preferences. When we looked at where our families eating, we found that 42.8% of families were eating at the kitchen table. Eating together is important, as this is where families connect with each other, where parents can be positive role models for eating, and where children can focus on and enjoy their meal. There is room for improvement, however, as over 1/3 of families reported eating in front of the TV or in the family room, and that can lead to distracted eating and less communication between families. When we looked about what they were doing while they were eating, 47.2% of families reported they were talking or socializing while eating, which is a great thing. However, 1/3, 29%, reported using screens such as watching TV or movies or using the internet. Sadly, screen time was highest among Ontario children ages 2 to 5 at 32.8%. Research has shown us that eating while watching TV is associated with poor diet quality among children. For example, consuming more sugary drinks, more high-fat, high-sugar foods and snacks, and fewer vegetables and fruit. The third section of our report looks at how families with children are shopping and preparing meals. For example, The majority of Ontario families shop at a grocery store, but they report more shopping at mass merchandisers and online compared to other Canadian families. So an example of a mass merchandiser would be Walmart or Giant Tiger. Ontario, so we looked at also where families, how much time families spend preparing meals. And Ontario parents are more likely than their Canadian counterparts to spend up to 30 minutes on meal preparation. We see that most meals are prepared in 30 minutes or less. Parents of children aged 2 to 5 are more likely to spend at least 30 minutes on meal preparation compared to parents of older children. The amount of time Ontario families reported spending on meal preparation decreased as families got older. So 50% of parents with kids ages 6 to 12 and 59% of parents with children aged 13 to 17 reported spending less than 15 minutes on meal preparation, which is the largest category, as you can see on the slide. So we looked at cooking from scratch and convenience foods and found that Ontario families reported cooking from scratch, but also aimed for some convenience. Nearly half, 47% of Ontario families reported preparing meals completely from scratch. Parents of children ages 2 to 5 largely drove this trend for home prepared meals, with 57.3% of parents of young children reporting on this. Use of meal kits was reported to be highest in families with children between the ages of 6 and 12. So our fourth section looks at information about what influences the food choices of families with children. So as we can see, food labels are really important for Ontario families. 48.8% reported looking at the nutrition label and 44.7% looked at the ingredient list. So, a high number of parents are simply looking at the label. What they're looking at on the label is information such as made in Canada, the best before date, all natural, organic, free range. Some of these things are top priorities for Ontario parents to help them make their food choices. Our report actually provides more insights into how parents rank information such as whole grains, gluten-free, non-GMO, protein, and other label information. When we look at where families are sourcing their information, almost half of Ontario parents source their food and nutrition information online. And then there were other sources of information such as word of mouth, TV, in-store, other magazine, wearable technology, Canada's Food Guide, and billboards. We looked a little bit deeper into some of this information, found that Canadian households with children seek information about food and beverages online through company websites, social media, and third-party websites and blogs. With social media and blogs, the credibility of nutrition information can be challenged as the nutrition information may not be evidence-based. Given the prevalence of technology and smartphones, especially among younger generations, there is an opportunity here to optimize digital content to disseminate to parents with children. So this is just some of the information that we have included in our report. Other things that we haven't shared today is information about the dietary preferences of Ontario families. What we gleaned there is that we are still mostly meat eaters in the province versus vegetarian or vegan. So we do discuss the various kinds of food preferences of families. We also haven't shared with you today the top ranked motivations for Ontario parents when choosing foods. And we're all very familiar with some of these reasons, such as choosing foods based on good value for money, or whether they're good for my family, whether they're easy to prepare, or whether people simply wanted something tasty. So there's quite a large list of motivations for parents that we report in our report that is of interest to many of us. What we have gleaned from this exploration of food and eating in Ontario families is that there are opportunities to support our work and yours to communicate with parents and target messaging that may make a difference in improving the food choices and eating habits of families with children. Some of these are promoting more family meals and eating together, decreasing mealtime distractions such as screens, offering ideas for planning healthy meals and snacks, and how to engage with parents to help them make the best possible choices for their children. We trust that you can see the value of using this information to help advance your work. So I'm really pleased to announce that the report is available today on our website. We also hope that you might be interested in ordering the complete report, as there's a lot of information I don't really have time to go into details for today. We hope that you will understand that as a not-for-profit organization, we've had to charge for this report. These types of studies cost thousands of dollars and are mostly done by companies to direct their business development strategies. We are very thankful for the support of the Elderly Foundation, whose funding made this report possible. We also wanted to let you know that Nutrition Connections is a key program of the Ontario Public Health Association, who is a registered charitable not-for-profit organization. So as a registered charity, the proceeds from the sale of any of our resources and services goes towards work that promotes public education on nutrition and healthy eating. So if you are interested in ordering the report, you can go to our Nutrition Connections website and you can find out more details about the report there. I also, before I finish, I wanted to really share with you some new directions that we're taking here at Nutrition Connections. We're ready to launch a new membership service called the Connected Insider, which will go live in January of this new year. And we're really hoping that you'll take a look on our website and see the value of a possible membership. Connected Insiders will gain an all-access pass to expert curated development package content and training opportunities such as webinars and workshops, with several updates being made to our most popular resources such as Feeding Your Baby, Healthy Eating for a Healthy Baby, and our Healthy Eating Manual, which is now being turned into a toolkit. You'll see that there are discounts being applied to those people who would join as a Connected Insider. You'll also get discounts to some of the reports that we have talked about, particularly the report today. There will be a nice discount if you are interested in joining as a Connected Insider. So just want to let you know that, again, you can go to our website and you can look at the list of benefits that you will gain from joining and being a Connected Insider, and we hope that you will consider joining us. I also wanted to let you know that we have a forum taking place in the new year, and like many other organizations, we're offering our forum virtually. We have an exciting 3-part forum series called Eating Reimagined, starting on January 28th, with food in landscapes and challenges of today, followed by nutrition and mental health, and a final session on anti-racism and representation. You can visit our forum website to learn more and to register there. So that brings my presentation to a close. If you have any questions that you would like to answer, please enter them in the Q&A box or send them in the evaluation that we will be emailing to you after this presentation. We'll try to get to a number of questions today, but certainly if you have any additional questions, you can certainly email me. For those of you who are able to complete the evaluation, there will be a discount code that you can apply to purchase our report. So please consider filling out the evaluation. So that concludes the remarks that I wanted to share with you today and some of the highlights about our report. We're really pleased that you could attend here. And again, once again, I would like to thank our sponsor for this report, the Elderly Foundation, and also the Ontario Public Health Association and my colleagues at Nutrition Connections for their help launching this report and our new services. So now I think I'll hand it over to Marissa to see if we have any questions.
Great presentation. We do have two questions. So the first one is, in your opinion, how do you think COVID-19 has changed meal and intake patterns? My patients have been inquiring more about recipes for frozen meals / batch meals and recipes using canned or frozen proteins.
Yeah. Thank you for that question. I think, as I said, we did collect a little bit of data about the situation in related to COVID in our study, but we've also done a lot of looking at reports that others have done, such as the Dalhousie group on grocery patterns and cooking patterns and things like that. So really, I think a lot of people are really stocking up. And so we're seeing actually people using more processed foods, canned goods, packaged goods, because those are the kinds of foods that can be stored for longer periods of time than fresh foods. So that is one thing we've noticed. I think people are looking at spending more time actually cooking meals and looking at more recipes. And so the batch cooking idea for sure is a great, thing that people are doing. Instead of making one batch of spaghetti sauce, they may be making a batch to last them several meals and freezing what they don't need. So I think that eating patterns have been influenced by really our grocery shopping restrictions, and people are trying to shop less, maybe once a week instead of twice a week. We did see in our study that families in Ontario were more likely to shop more, make emergency pickup trips, running to the grocery store, particularly for the ages, parents of children ages 6 to 12. So I think that, with the COVID situation, parents have had to change the ways that they do their shopping and their meal planning. In terms of recipes, I didn't really answer that, but there's certainly lots and lots of recipes that parents have been finding online and can find online. We like to refer people to the Foodland Ontario recipes here in Ontario because they're made based on local food. So I would suggest checking that site out.
And then we have another question here. It says, in your data, you mentioned that you reported the findings of families with members of different ages. Where are the 18 to 24-year-olds? For families with members of this age group who were living at home during the time of data collection, was there just not enough to make conclusions, or was there another reason why they were left out?
That's a good question. We purposely asked IPSOs they can slice and dice their data analysis any way that a client is interested in seeing the data. So we purposely asked them to break down the data into these age groups, the 2 to 5-year-old, 6 to 12, and 13 to 17. There may have been some older children in the family, but we are really focused in on finding out, having the parents identify by those 3 age groups.
And then if we just have a couple more minutes, we have one last question, and it was, did you take into consideration the average household income? If yes, did you notice a difference in the answers that family provided?
That's another good question. We didn't actually analyze the data by income. We do have the income levels of our population. We did find that we did have an overrepresentation of people in a higher income category. Where did I find that? So we had 52% of our sample was in an income making over $80,000 a year, compared to 14% of our sample was in a low income category. I mean, lower income, under $35,000. But we did not analyze the data by income. That would be a really great thing to consider. We do have the data. There is a possibility for us to look deeper into some of these issues, but that would require an additional cost to go into the data and get that analyzed. Yeah, I don't know if is there any more questions there, Marissa? We might have time for another one.
Yeah, so we have a follow-up on one of your previous answers. So do you expect or hope nutrition professionals working in food manufacturing industries will advocate for healthier processed foods?
Yeah, I think that's a good comment. For sure. I know there's a lot of processed foods that we rely on, from, spaghetti sauce to bread, and a lot of companies take it to heart when they see information like this in terms of how they can reformulate their products to make them healthier, whether it's reducing the sodium in breads or cereals, for example, or reducing the fillers and maybe some of the protein alternative products. There's all kinds of ways that the companies will look at their products to see how they can formulate them, as I said earlier, to make them healthier choices. And I don't think processed foods are going to disappear. I mean, we would all love people to eat more whole foods all of the time, but practically speaking, I don't think that that's going to be a way that going forward. I think we're going to have to look at ways to have some of those healthier processed foods that we can accommodate in our diet.
Thanks, Lynn. We have one more question if you think we have time for that.
Sure. Yeah.
Okay, so acknowledging that there are barriers associated with access to better foods and socioeconomic status, will your data be used to influence the barriers for families with lower average incomes, such as financial barriers or convenience?
Just trying to look at the question again. The last part of the question was barriers for families with lower average income, such as, yeah. So the studies done by Proof, who look at food insecurity and the challenges of families in accessing the foods they need. We know that food insecurity is an income problem, and we know that food literacy isn't a solution. We know that families with low incomes are actually much better at meal planning and budgeting than we are. I think some of the studies that we have looked at, we really have to find better ways for all of us to eat better and eat better more economically. We know the food prices are going to be going up. We've heard from Sylvain Charlebois in his latest food price report that prices are going up, even for healthy food such as vegetables and fruit. So I think we've all got to look at ways that we can, find foods and make the healthiest food choices and prepare the healthiest meals possible the most economical way. Not sure if I answered that question entirely the way you were asking it. And I think healthy eating, doesn't have to be as expensive. I think it really goes back to careful planning, careful budgeting. And I think now when people are looking at more reduced trips to the grocery store, people are actually getting better at meal planning. They're understanding that, I can't just run out and get something now. I have to plan my efforts. So I think the planning around the food costing is going to take a similar route. Setting a budget, doing your shopping list, sticking to your meal plan.
Thanks, Lynn. That was an excellent presentation.
Okay, well, I want to thank everyone for joining us today. And we didn't have a long presentation, so I'm sure there may be some more questions. As I said earlier, feel free to email us, fill out the evaluation. If you have additional questions, there is an open-ended question there that you can ask any additional questions. Anyway, thank you everyone for joining us today.